Bismillahirrahmanirrahim. Assalamu alaikum. My name is Abdullah Muhammad Rana. I'm a colorectal and general surgeon working at Flinders Medical Center here in Adelaide. Today we're going to talk about PR bleeding, that is per rectal bleeding, or in common words, blood coming in the stools or in the toilet. This is a very common problem which most of us face during their lifetime. The important things to look for is when are you bleeding, what is your age, what are the risk factors associated with it. The commonest questions we ask or we are asked every day is that could it be dangerous? Bleeding can occur from benign things and from malignant reasons as well. First thing we need to look for is how often is the bleeding, how much is the bleeding, what were you doing when the bleeding started, is it fresh blood or old clots, or is it mixed with both? Is it mixed with your stools when you're opening your bowels, or did you notice blood on your undergarments? What is your age? Are you on any blood thinners, that is blood thinning medication which is often used for cardiac reasons? Have you got any family history of bowel problems, and has that been investigated? Once the history is taken, commonly your doctor would do an examination to make sure there is no things that they can be felt at the rectum. The commonest reason is hemorrhoids or piles, which is one of the most common reasons for bright red bleeding. Often older people are on blood thinners. The gold standard investigation for rectal bleeding after history and examination is to do a colonoscopy. We are fortunate here in Australia that we have a bowel cancer screening program which starts at 50. The government of Australia would send you a national bowel cancer screening kit, and we strongly recommend that you use that kit, as that is an indicative marker that you have blood in the stools, whether you can see it or not. If the test comes positive, your general practitioner would refer you for a review with a specialist and a colonoscopy, and it is imperative that we undergo that examination, which is a day procedure with very low risks and complications, but we can find out what is the source of your bleeding. If it's hemorrhoids, they can be dealt with. The commonest thing that we find is polyps, which can be benign, pre-malignant or malignant, that is cancerous polyps. And if they are, they're usually dealt with there and then we are able to deal with them later. It's really important that the bleeding is investigated, looked at, and dealt with, as it can lead to problems that can turn malignant or cancerous. Thank you.